All right, welcome back. Let's get another perspective to this whole issue of self-isolation or home isolation, if you like. I'm now being joined on the program by Dr. Oluwole Ayodele, who is a frontline health worker in the fight against COVID-19 here in Lagos. Doc, thank you very much for joining us on the program. Let me start by asking you what your take is on this whole issue of home isolation, because you're actually on the front line.
Yes, thank you. I actually feel that might get here sometimes, and it might be the time might just be now. As we know that 80% of COVID-19 cases are mild to moderate symptoms. So we are beginning to see fairly asymptomatic persons. We've seen all over the outbreak of asymptomatic cases being admitted on the wards. And then the duration of stay of confirmed cases on the wards vary, okay? So the number of persons coming into the isolation centers is higher than the number of persons that are exiting from the isolation centers. And I'm sure this has prompted the need to reconsider the treatment pattern, especially for asymptomatic cases. So yes, I think that, as we all know, that COVID-19 might be something that will stay with us for quite some time. And then we must begin to look at areas and find the ways of managing cases, especially mild cases at home. So I totally am in line with the propositions of the Lagos State government.
But don't you think, and quite a number of other medical experts have also expressed this concern, don't you think this would lead to a further spread of the virus?
Yes, I mean, there is that fear, and truthfully so, I mean, we, the persons who have raised those fears are also in line, because since the advent of the COVID-19 pandemic, you have consistently emphasized the need to get the people to buy into the programs of government. And if the community, if the populace feel a certain way as to what government is saying, and then the decisions and the directives of government, and then if they're bringing this, as with so many things that we've seen, we've looked at how the lockdown has been close to ineffective. We've seen how the use of face covering and face masks have been ineffective. We've seen how movements and social distancing has played out. We've seen how the persons who are supposed to put in place things to make people stay at home, we've seen how all those have played out. We've seen how the palliatives have played out. So there is a fear that, yes, if we say that persons with mild symptoms should stay at home, might now infect some other persons. That is really true. But like as always said, it is time for the people to take responsibility. We've said this over some time now, that everybody needs to take responsibility now. We can't say that we want to get our lives back. We can't say that we want to go back to our normal businesses, and yet we would not follow the directives from government. Government are not just opening the books and then dishing out to us. It is with research. It is with close looking and deliberate looking at the situation, okay, and seeing how we can quickly manage the situation we have at hand, vis-a-vis getting in patients and then testing. You know, at the time we talked about testing and how much tests we need to have. Now we are getting enough testing. Now we are getting confirmed cases. We also need to plan, how do we continue our lives with all of this? So education is key for people to know that at this point, when we are looking at situations where we might be staying at home to manage ourselves based on the guidelines that governments have provided, a lot of interactions, a lot of education needs to go to the general public so that they can follow these guidelines that the government is trying to set.
Now, let me paint a scenario for you here and get your take on it. Just take, for instance, the housing situation in Lagos. Or let's just take, for instance, the slums of Lagos, a place like Makoko, for instance, Ijorabadi and all those places. Imagine where an individual who lives in one of these places contracts the virus and lives in a one-room apartment or just a shack and lives there with the wife and children. How do you deal with such a situation where this person contracts the virus and he lives with the family? How do you, for instance, ask this person to isolate under that kind of condition?
Yes, thank you. And this has resonated all through the period of this pandemic. And we've seen how individual countries have also dealt with situations at hand. We know that the situation with us, as you rightly described, is in about 50-60% of cases, if not more than that. So how to stay and with the guidelines of isolation is key at this moment. As much as we say that citizens should take responsibility, they should listen to guidelines that government have provided, the government also needs to provide some specifics, okay, for situations that absolutely are not in the hands of these persons. Okay, what we've tried before is to take persons away from their homes for treatment. Okay, so if you are focusing on, say, severely or acutely ill persons, and that is where our focus wants to be, then we should also have provisions, okay, for persons who will not be able to, fit into these guidelines, because the guidelines is not a one-size-fits-all. It has to be in such a way that is going to fit into people's normal day-to-day lives, so as to stem the tide of a possible transmission across board. So if government needs to have a facility, for instance, where they need to bring in persons who are totally unable to be in isolation, or extract them and their families, then it might be something to look out for.
Well, Dr. Oluwole Ayodele, thank you very much for joining us on the program, and thank you for your contributions. Well, it's a very tough situation and a very tough one, no doubt, for the government. How to deal with the rising number of cases and the corresponding shortage of bed space. It's definitely going to be a very difficult one. We'll just wait and see how this whole situation pans out. But obviously not a good time at all for Nigeria. And this is not just for Lagos alone. I mean, we see this in other parts of the country as well, where it would appear the government, I should say, of some of these states now, the government, I should say, are gradually running out of bed space. We'll just wait and see how this pans out. But no doubt, not a good news at all. And of course, there's a danger with home care management of cases, because there's a possibility that things could spiral out of control, especially in a country where most people lack the discipline to self-isolate. So wait and see what happens. That's it on the program. If you want to watch it again, it's very simple. Just you can go to www.TV360 Nigeria. You'll see this program and lots more there. You can also follow the conversation on our various social media platforms. Thank you very much for watching. I'll see you again next week. Bye-bye.